Now here I would like to share with you one of my stories. When I started my dental practice, hello doctors, welcome. Today in this video we are going to discuss a very important instrument of every dental clinic, and that is Air Rotor or dental handpiece. The reason for us to discuss this basic dental instrument is because this is one of the instruments that brings us most of the earning. That is, majority of the dental treatments cannot be performed without the help of dental Airrotor. As it is a very integral part of our daily practice, I would suggest every dentist should have a thorough knowledge on Airrotors, mainly how to use them, how to maintain them, how to increase their life, also how to repair them, etc. Through our this 2 video part series, we are going to cover A to Z regarding dental Airrotors, and at the end of this 2 video part, you will have thorough knowledge and complete knowledge regarding dental Airrotors. There are many small fundamentals and basic questions that many a times new dentists or students have regarding dental Airrotors. But the most common questions regarding Airrotors that I receive are: which is the best Airrotor to use? Which is the economical option for dental handpiece? Is it necessary to always buy an expensive Airrotor? How to oil an Airrotor? How to maintain an Airrotor? How to increase the life of Airrotor? How to change cartridges of my Airrotor, and also how to repair cartridges of our dental handpiece. So doctor, with this 2 video part, I am going to cover all such questions and we are going to clear out all the confusions permanently. Also, you all are very familiar with our channel and our ritual, and that is we always love to talk about topics which no one is talking about or which are not mentioned in any of the books. And also sometimes answer for such questions are very difficult to find. So once again, hello doctors, I am Dr. Tarun Mavadia from Aksar Dental Academy. Let's begin. Doctors, in this first video part, we are going to discuss following points. Number 1, importance of Airrotor and few misconceptions regarding Airrotor. Number 2, types of Airrotors available. Number 3, ideal features in any Airrotor. Number 4, what should you buy? And last, number 5, what I use in my daily practice. A small disclaimer at the beginning of the video. Doctors, I am here just sharing what I use daily and through my experience what I have learned regarding Airrotors and how to maintain them, how to use them, etc. We are not associated with any company or any website as such. This is just a small step from our side to guide you all to a perfect pathway, and you can be the judge of the products and etc. things suggested over here. Also doctors, depending on how late you are looking at these videos, sometimes the prices shared in the video can change after few years or months. So please keep those things in mind. Now coming back to our topic, point number 1, importance of Airrotor and few misconceptions regarding Airrotor. Doctors, it is believed, and I also truly think, that an artist is nothing without his equipments or instruments for his art. We dentists are partially artists, engineers and medical professionals, and the best artistic instrument for us or engineering marvel or also a medical equipment for us is dental Airrotor. We dentists can also be nothing without our Airrotors. Doctors, now as such, every dental clinic has dental Airrotors, but there are few fundamental mistakes and misconceptions regarding dental Airrotors, and that is why we are here with this topic. Few of the major misconceptions are: number 1, costlier Airrotors have longer life. Answer is no. A life of an Airrotor depends on how you use it and how you well maintain it. Second common misconception is autoclaving the Airrotor daily damages it. Answer is no. Autoclaving your air rotor is must and should be done daily. The third most common misconception is only one air rotor is enough for my dental practice. Answer is no. You require minimum 3 air rotors in your clinic, and depending on the number of OPDs and patient you use, I would suggest you it's not a bad idea to have few of them in spares also. Now here I would like to share with you one of my stories. When I started my dental practice, there was nothing like YouTube, and such practical knowledges were very difficult to acquire. So as any dental student with a very cheap nature in my mind, and also I was on a very tight budget, I set up my dental clinic, and my first idea and most of the suggestions which I got was get a good quality expensive air rotor. So I bought an NSK rotor worth rupees 7,500 I think at that point of time. Along with it, I had one of my air rotors from my intensive days, but I just kept it aside and I was not at all aware about it. I was not considering it at all. Now after my practice started, after few months or one year and few months after that, I came across an issue. I was supposed to be performing crown cutting for a 6-unit bridge in the lower anterior region, and it was a big deal for me because for any beginner students or any beginner practitioner at that level, having an opportunity to do 6 crowns is very important for the budget and also the expenses of the clinic. But unfortunately, while performing that crown cutting, the water from my air rotor stopped coming out, and also the cartridges was making some of the other noise. At that point of time, it was a severe shock to me because I cannot skip the work in between, and also I cannot transfer the patient or change out the appointment. So luckily at that point of time, it struck me that I have my intensive air rotor. I instructed my assistant to find it, and luckily it was working good, and then I was able to continue the appointment, and in such a way my patient work was done. So suppose if I did not have any spare instrument, basically I did not bought a spare instrument, it was luckily with me and I was able to use it. So similarly, such situation does not arise with you all. I would suggest you all, you should have 3 air rotors. And why I am suggesting you 3 rotors and which 3 air rotors you should have, we are going to cover those detail in further video. Okay, so please try to remember everything that we are suggesting in our channel are tried and tested by me with many years, and also every mistake or everything which I am trying to tell you to avoid, I have gone through those mistakes. I have gone through many financial losses also. I have wasted a lot of time. I have wasted a lot of energy in many things related to dentistry. So for all the new students and all the people beginning their journey with dentistry, I would suggest you can trust every content on this channel, and I can guarantee it will never land up you in trouble. Okay, so coming back to our topic, doctors, in order to understand dental air rotors and which air rotor can be best for you in your daily practice, you need to have an understanding of the next point, and that is point number 2, types of air rotor available. Doctors, there can be few types of air rotors available depending on cartridge bearing type, different working head or ends of the air rotor, burr insertion mechanism of the air rotor, torque of the air rotor, and the build quality of the cartridges. The few important must-know points based on few of these types of air rotors are as follows. Doctors, the most important category that you should look for whenever selecting your main air rotor for your vital tooth and other types of important use with air rotor is the cartridge bearing type. Based on the cartridge bearing type, there can be basically 2 types of air rotor. Number 1, steel bearing type, and number 2, ceramic bearing type. My recommendation is to go with ceramic bearing type. Next is types of air rotor based on the working end or the working head of the air rotor. Doctors, as you can see in this picture, depending on the working end or the working head of the air rotor, there can be many types of air rotor available. One important point to notice over here is
the new dentists being more attracted towards the mini head air rotors and sometimes 45-degree air rotors. The few of the reality with this type of air rotors are the mini head air rotors, the cartridges damages very soon and they have a very short period of life. And for the 45-degree angle, this type of air rotor will be useful to you only in some specific locations or position of the tooth. So doctors, as I always teach this in our academy and I always would insist every dentist to do is, better to improve your skill with one or a normal type of air rotor than to invest your money in different types of air rotor. When you increase your armamentarium, you need to invest more and it is also a cost to you. And then you need to maintain them up also. So if you develop your skill with only one or two types of air rotors, then your cost is less, you need to invest less in dentistry, and also you need to have less armamentariums or repairing charge, etc. So I try to believe on a principle that every penny saved is an every penny earned. And here, by only going with normal head, that is ceramic bearing head air rotors, you can save money on many other types of air rotor heads that are available. Doctors, please believe me, if I can go through dentistry with normal standard head air rotor for more than a decade, and if I can increase my practice from 1 clinic to 3 clinics and also establish an academy with only a standard hair rotor head, then definitely majority of you can also do it. So please improve your skills and depend less on different types of categories of equipments or instruments. Next is types of air rotors based on the burr insertion mechanism. Doctors, based on this category, there can be basic two types of air rotors available. Number one, push button type, and number two, the chuck or changer type. My recommendation over here is to go with the push button type air rotor. I would suggest you to avoid the chuck type air rotors or changer type air rotors because many a times if the burrs are not inserted properly or if more pressure is given while tightening the air rotor, sometimes the mechanism that locks the burr into the air rotor gets damaged and ultimately the air rotor is of no use to us. So better to go with push button type air rotors. Next is number 4, types of air rotor based on the torque generated by them. Based on this category, there can be basic two types of air rotors available. Number 1, normal or standard air rotor, and number 2, super torque air rotors. Doctors, my suggestion would be you should have at least one super torque air rotor in your dental clinic. This type of super torque air rotor, they generate more torque. So the cutting efficiency by the air rotor is more. And you can use such air rotors in order to cut out your old crowns whenever retreatments are required, or in order to remove your old amalgam fillings, or you can perform them whenever some heavy load or whenever any work which will give more damage to the cartridge or where more pressure is required. Next is number 5, based on the size and the shape of the cartridge design. Doctors, as you can see in the screen, there can be different size and shapes of the cartridge in different types of air rotor depending on the company's choice and pricing, etc. My recommendation is to go with such open types of cartridges because such type of open cartridges, they generally don't allow the debris to stay inside and good amount of oiling can be done in them. And one of the important point is this type of open cartridges comparatively are more easy to repair. And doctors, yes, don't worry. In our upcoming videos, I am going to show you how to replace your cartridge in your air rotor and also how to repair your damaged cartridges. So doctors, now knowing about the different types, categories and options of dental handpieces or air rotors available, the next logical question going through your mind will be, which is the best air rotor for our daily dental use? And that brings me to our next topic, and that is ideal features in a perfect air rotor. So doctors, according to me, the best or the perfect air rotor for our daily dental use should have the following features. Number 1, The first and very important feature that I always look for before purchasing anything, and that is the cost factor. So definitely the best Airrotor or the perfect Airrotor for us should be economical by price. To all the members of our V Dentist group, you will be very familiar that whenever I give any suggestion, one of the important factor is always cost price, and me discuss many a times the different types of materials and equipments, and I always try to find out the best and the most economical options to your queries. So similarly, when discussing about Airrotor, this is also a very important factor, and definitely the cost factor is to be considered, and that is why the must-have feature for our perfect Airrotor has to be its cost price, and a perfect Airrotor should be economical. Doctors, as discussed earlier, it is a wrong belief that expensive Airrotors will last longer. The second important feature for our perfect Airrotor is it should have ceramic bearing cartridges. Doctors, you should always prefer a ceramic bearing cartridges in your handpiece because ceramic cartridges are very smooth and very good in function. They generally have a very good life compared to the steel bearing cartridges, and also they are best for the vital tooth cutting and any type of treatment in a vital tooth. So according to me, your dental clinic should have minimum 2 ceramic bearing Airrotors. The third important feature for our perfect Airrotor is it should have push button type burr insertion mechanism. Doctors, as discussed earlier, out of the two chuck type or changer type and the push button type mechanism, the push button type mechanism is really very easy to use, and it also saves time during the treatment like cuttings whenever we need to change the burr. Doctors, as discussed earlier, every penny saved is an every penny earned. Similarly, when you save so many seconds in multiple treatments throughout the day, it is a valuable time earned by you. So doctors, during our courses, this is also one of the topic that we discuss, and that is how to reduce your chair side working time. And it is always appreciated by the patient when the chair side time spent is very less. So similarly, by using the push button type cartridges, you can save many seconds each time during changing your burr, and also it is one less instrument to be autoclaved, and that is your changer. The fourth important feature for our perfect Airrotor is the easy availability of the dental cartridges. Doctors, I would always suggest you to go with an Airrotor for which the cartridges are easily available. So generally I give suggestion to the dentist whenever they are buying a new Airrotor, at that point of time only you should go to buy additional 2 to 3 cartridges. So whenever in future you have any issue, you can immediately change the cartridges at that point of time. Many a times dentist tries to go for an Airrotor which are newer in nature and generally they are cheaper. But whenever there is an cartridge issues, then those companies are nowhere to be found, and also cartridge availability is an issue, and thus the whole Airrotor is of waste now. So please form this a habit. Whenever you buy an Airrotor, go for buying a few of the cartridges along with it depending on your use. So this is one of the practical tip that I have acquired through my personal experience. The fifth important feature in our perfect Airrotor should be the cartridge should be open type. As you can see in the picture, doctors, this is one of the things that I've acquired through my practical experience of more than a decade in dentistry. I have used all type of Airrotors and all type of mechanism and size and shapes of Airrotor, and I conclude this at the end of a decade of a use that whenever you go for purchasing a new Airrotor, if option is available, prefer any Airrotor which has this open type cartridges. This open type cartridges generally allows the very less debris to be accumulated inside. Those debris can be easily flushed out with our Airrotor spray, and also This type of open cartridges are generally more easier comparatively to repair or replace the ceramic bearings. And doctor, now the last and must-have feature for our perfect air rotor should be the location of the water outlet spray. Doctors, I would suggest you to select an air rotor which has an outlet of water spray at the neck of the air rotor, as you can see in the picture. I would suggest you to avoid such type of air rotors where the water spray are more in number and are surrounding the burr insertion point. Doctors, why I am suggesting you this is the purpose of water jet spray is that the water should get directly sprinkled at a point where our burr is touching our tooth structure. And this can be achieved more with this location, that is at the neck of the air rotor. There are many newer air rotor available where the water outlet holes are given surrounding the burr insertion mechanism. And one of the issue with this mechanism is more amount of water is sprayed, and that is also on top end of the air rotor. And when air rotor is revolving at a much speed, the water droplets try to hit each other and more amount of aerosol or mist is created in such type of air rotor. And at the time of Corona, when we were trying to reduce the amount of aerosol generated in our dental clinic, most of you must have noticed that these types of air rotor were of a major concern. Also, they don't serve the purpose of water getting sprinkled onto the junction or point where our burr is touching our tooth. So doctors, I would suggest if possible, go with an air rotor which has a water jet location at the neck area, and here water can be directly sprinkled at the junction of our tooth and our burr. Another additional benefit is whenever these water outlet holes are blocked due to any of the debris, if they are located at this neck area of the air rotor, then it is easier to pass a wire through it and to clear out the blockage. But if these water outlet holes are located around the burr insertion mechanism, then I have found they are difficult to clear from the blockage. So doctors, based on my two evaluations, that is inability to clean the water blockage and also the water spray is not perfect or not angulated properly at our necessary or required point, and that is why I would suggest to go with such type of air rotor and try to avoid air rotors which have more holes for water sprinkle. Also doctors, I would like to share with you one of this picture. This is just to let you know that I have gone through dentistry through lot of experiences and lot of expenditures. I have tried out so many type of material, and similarly you can see in the picture I have tried out lot of air rotors also. So I am here in front of you giving you suggestions only after trying them out and going through lot of hardship with them. So as I always mention, all the advices and tips and tricks that you find on our channel are tried and tested by me personally for more than a decade. And also I have been teaching them since more than 7 years. And they are also tried and tested at my all 3 clinics and by many of the doctors whom I have taught. So whenever you find anything on our channel, you can definitely trust it out and feel free to contact me in case of any doubt related to dentistry. We are always here to help you out. Doctors, now the obvious question from your side will be, then what air rotor should we buy? So whenever this question is asked to any of the old practitioners, most of the old practitioners have a huge practice, and generally they have one material guy who supplies them the instruments and air rotors when required. So they prefer to go with the costlier one because at that point of time the good air rotors were always costlier. To the new doctors, I would like to suggest that times have changed and there are many good air rotors available and which are economical also. Right now in this generation, it is a very wrong thing to believe that only expensive air rotors can last longer. The first important factor or the most important factor is how you use the air rotor, how you maintain your air rotor. And doctors, in our next or following video, we are going to discuss on this topic also. But right now, I would like to suggest you that there are economical options available, and I am going to suggest you Air Rotors which will fulfill all our necessary features for a perfect Air Rotor. So doctors, that brings us to our next topic, and that is, what Air Rotor should you buy? Before coming to the exact name and the company of Air Rotor that you should buy, first I would like to suggest you that how many Air Rotors should you have in your dental clinic. And also I would like to share my logic behind it. So doctor, according to me, you should have minimum 3 of the Air Rotors in your dental clinic. Out of these 3 Air Rotor, 2 of the Air Rotors should be ceramic bearing push button type Air Rotors, and 1 Air Rotor should be super torque Air Rotor. As discussed earlier, ceramic bearing type Air Rotors are very smooth in function, that they have a greater life, and I find they are best to work with vital tooth and also performing treatment in vital teeth. So you should always use ceramic bearing Air Rotors for your major dental treatments, and that is why I am suggesting you to have 2 of the Air Rotors with you. Now if you are a new dentist and number of patients are less in your operatory, use 1 Air Rotor daily for your purposes and keep the second Air Rotor as a spare. For the doctors who are blessed and who have more experience and are having huge number of patients daily, I would suggest you should use the 1 Air Rotor in the morning section and the second Air Rotor in the evening section. Now generally and ideally you should use the sterilized Air Rotor for every dental treatment. But we all know the fact. So I would insist, if you can do that, it should be done, it should be ideal. But most of the dentists will not be able to perform them, and it will be a financial burden for a new dentist. So I would suggest at least use 2 Air Rotors, sterilized ones, 1 for the morning session and second for the evening session. And yes, it is totally understood that after every treatment, including your dental chair and your Air Rotors and 3-way syringe, everything should be sprayed properly with a sterilium and should be cold sterilized. Also doctors, my third Air Rotor suggestion is to have a super torque Air Rotor, and you can use this super torque Air Rotor whenever you need a very heavy workload to be done, or whenever the stress coming on your Air Rotor is more. And few of such treatments can be cutting out the old crowns or bridges, removing out the old amalgams, etc., sometimes cutting through any prosthesis, etc. Generally, this type of work leads to more damage to your cartridges, and that is why you should have a super torque Air Rotor. Most of the super torque Air Rotors are steel bearing based Air Rotors, and also they are economical. So by using this Air Rotor specially for a heavy load work, you can spare the damage and expenses on your ceramic Air Rotor. And also doctors, please remember, whenever you perform any of such heavy treatment, you should definitely charge additional from the patient, because it is going to lead you into damage to your Air Rotor, and you need to replace out the cartridges or your Air Rotor at some point of time. Just for general information, as discussed earlier, whenever you buy super torque Air Rotors, buy extra cartridges along with them. And whenever you are going to perform such treatments, and if cartridges will have less torque generated with use, you can change out the cartridge yourself. So doctors, this is why I am suggesting you to have minimum 3 Air Rotors in your dental clinic. And another main reason for me to suggest you to use a separate Air Rotor for vital treatment and another type of Air Rotor for your heavy load or PFM cutting, etc. work is because when the ceramic cartridges with use become less effective and their cutting efficiency reduces, generally the dentist tries to give more pressure with the Air Rotor on the tooth surface, thinking that the burr has gone bad or air pressure is less. But actually it is an issue with the cartridge. So please remember, my fellow dentist, nothing is permanent for life. So your 1 Air Rotor which has been working for months and for years for you also has a life. So please have this understanding also. And whenever the cutting efficiency of your air rotor reduces, first and foremost check out with new burrs or additional burrs. And then even if you are not getting a good cutting efficiency, it means it is time to replace your ceramic cartridges. If these steps are not done properly, then you can land up into disaster of getting more heat generated while tooth cutting in vital tooth or drilling, etc. And this can have bad effect on the tooth and sometimes can lead you into disaster. So please have this understanding and try to avoid complications as much as possible. So the fast summary is you should have 3 air rotors in your dental clinic minimum. 2 air rotors should be ceramic bearing type push button air rotors with the water spray at the neck area of the air rotor. And you should have 1 super torque air rotor. If you can find it with ceramic bearing, great. Otherwise, steel bearings will work also. But you need to have additional cartridges for both the type or all the 3 air rotors, so that whenever required, you can easily change out the cartridge yourself. So now finally we come to our last point, and that is what air rotors I use in my daily practice. Doctors, again a small disclaimer. I am not associated with any company. I am not associated with any website. But my aim is to provide economic and good suggestions to my new fellow dentist. And as a part of that courtesy, I am sharing out the pages or the name of the rotors that I use and also the current pricing of them right now. Depending on at what interval or after how many years you are watching this video, the air rotor prices can definitely go up and down, and also sometimes the air rotor's quality or build or name might change. So if you face such issues, feel free to contact us no matter after how many years you are looking at this video. And at that point of time, contact us through WhatsApp and we will be more than happy to share you the economical and the perfect option for you at that point of time. But as such, for time being, in the February of 2023, these are the economical options that I was able to find for you. And also, these are the rotors that I use in daily practice. So here you can see in the picture, this is my ceramic bearing air rotor. Okay. As you can see, it is steel packed and sterilized. Now, whenever in our course, whenever I show my air rotors pictures, which are just seal packed and sterilized, one of the first questions that is asked is why there is gauze piece around the air rotor. So doctors, there is a funny story to it. Initially, when I started my clinic, I had only one dental assistant and only one air rotor, as I told you earlier. So my dental assistant was not a trained dental assistant. It was difficult to find in my city. And also, if available, I would have not able to afford it. Okay. So I came up with this idea. I taught my assistant to put gauze pieces around it. So whenever removing them from the packing, etc., or along with the packet, if the air rotor falls down, the damage to the air rotor head or the body is not caused. Okay. But with time, as the old thinkings are generated or transferred to us, like one of them related to air rotor is expensive air rotors are always better and they will last you longer. There is no proof for this, but it is coming on from generation to generation. Similarly, when I taught this to one of my dental assistant, then when the dental assistant was about to leave and I got my 2 other new dental assistant, this same knowledge was transferred over there. But with time, my dental assistant who are currently associated with me for more than 5 and one of them assistant is more than 10 years, they have still kept on the protocol or the daily ritual, but my dental assistant are also more economical in nature compared to me. So with use and with years, the number of gauze pieces or the thickness of gauze pieces has gone down, and slowly they are coming. They are trying to save me money, thinking that using less of gauze piece will save me a lot of money. but still it is their kind gesture and they are doing it, but they are now more effective and more careful in handling the air rotors, etc., because they are associated with me since more than 5 years or so. So I'm bringing out this story to suggest you two things: that whatever you teach to your assistant, please explain them the purpose, that the purpose of gauze piece is to prevent it from damage, so put good amount of gauze piece. Okay. And second important thing is, try to retain your old dental assistant. I have seen many doctors, they just change out the assistant whenever the assistant will ask for a raise, or whenever assistant passes through 2 to 3 years of practice in your clinic. Please remember, trust is a very big character in an assistant or in your fellow worker, and it is very difficult to find a trustworthy assistant, or it is very difficult to find a trust factor from a person. So if you have your old assistant, try to retain them. Don't value everything with money. Please remember, everything in life cannot be measured with money. Okay, definitely money is necessary. I'm not telling that, but you should value person more. And believe me, if you have your old assistant associated with you with longer period of time, even your patient will value you. Your patient will value you, that you are keeping your assistant for longer, or you are able to retain your assistant for longer period of time. And even your assistant will be more familiar to the old patient and they will enjoy their company. And that is why I am suggesting you to, if possible, try to retain your assistant. So coming back to our discussion, as you can see, these are my two ceramic bearing air rotors. One of is from the company which I am suggesting you right now, and I am going to share the picture with you. Another one is around 5 years or more older air rotor, and that point of time this air rotor with ceramic bearing was economical in nature, and at that point of time I bought that air rotor. So for ceramic bearing type air rotor, here you can see the page, and you can see from the website where it is currently present. You can do a search yourself, and if you can go for it. Okay. And for the super torque air rotor, this is my super torque air rotor, but currently I was able to find a more economical option for you. And in this option, along with the air rotor, there are 5 additional cartridges also provided. So as you can see in the picture, please go with this air rotor. You can do a Google search by yourself, and if prices have not increased, this can be the economical option for you. So doctors, that's all for the first video part of our series on dental air rotors. We'll be soon coming up with other videos and other important things related to air rotors, and that is how to use your air rotor, how to increase the life of your air rotor, how to maintain your air rotor, how to service your air rotor, how to change cartridges of your air rotor, and also how to repair your air rotor cartridges. So as always, stay tuned to the channel. See you all in yet another interesting dental video. So doctors, again I would like to share an Easter egg with you all. Many people are watching our videos, but only very attentive people who go through the complete video can find our Easter egg and also the information. So if you are still here, you have a very good quality of completing the task that you hand, and this is a very good quality. You should understand this is an educational video and you should go through the whole video. It is a very good habit. Not wasting your more time. In the description you will always find good deals, good current events, and also few of our gifts which we give to our subscribers who join our WhatsApp group. So I would suggest you, if you are willing and if you are desiring such patient educational models and brochures which are customized in your own name, go through the description box and join our WhatsApp group. For all the dentists who are new to dentistry and who are new to their dental practice, or who are planning to establish their dental clinic, it is a must for you to join the group. Right now it is the most current and happening group in dentistry, and most of the members are the young dentists currently starting their practice or planning to start a practice, and there you will find answer to all your questions which are not in the books, like how to set up a dental clinic, what to take care of, where to put your wall mount x-ray, what can be good option, wall mount or portable, and there can be thousands of such questions, and we'll be more than happy to answer you all. As you all are aware, my aim is to make dentistry great in India. And in order to that, first and foremost, we will need good, skillful and great dentist. And in order to make dentists great, they should have a good and effective practice. So feel free to contact us. We will be more than happy to answer your any questions. No question is a stupid question. Also, we have successfully conducted one of our free composite lectures for our subscribers and group members, and it was a successful event. Similarly, after a few months, we are going to again conduct a similar kind of full composite course, and attending that course, I can guarantee it will change out composite for you for life. I have been doing dentistry more than a decade, and in these many years, I have spent a lot of money. I have gone through many financial losses, and I have gained many experiences. And along with all these experiences and attending many lectures, spending lot of money, lot of time, and going through many places and acquiring different and small tricks and tips regarding composites, you can find it in our super master class of composites. It is generally 1 hour or 1.5 hour daily online, so anyone from anywhere in the world can attend it. In order to value or to thank our subscribers and our group members, we provide it for free. The reason behind is, during my initial days of practice, composite was one of the type of filling. With my intraoral camera, I was able to convince lot of patient, and composite was one of the treatment that helped me survive. And for first initial 7 to 8 months of my dental practice, my clinic was running and my expenses were maintained due to this composite filling. Composite has a very special connection with me, and that is why I try to teach the perfect composite filling to the new dentist, so that they can do great composite fillings and they can also increase their livelihood. So one of my aim for this composite class or during any class is to impart you correct knowledge. Along with that, my most important aim is to increase your earning, because ultimately we all are doing this for our earning. So if you have a huge knowledge regarding a topic, but if you cannot convert it into earning, then it is of no use. So in this master class, you are definitely going to become master of composites, but along with that, we are going to share you practical tips and which has been tried out by thousands of dentists, okay, and how to increase your earnings, and also how to convert a patient to go for a good quality or premium composite fillings. So if you are a new dentist and if a patient is getting filling done from you, it is not a matter of proud that you patient got a filling done from you. In the current time period, the competition is so high and number of dentists is so many, that when you are able to convert a patient to a good quality and premium type of composite filling, then it is a matter for you to take pride. That is why we are conducting this composite master class. It is going to be generally 2 times a year. So for our January month, we have already completed it up. Meanwhile, you can join our group and we'll be going to share you the details of our next composite lecture. Generally, it will be around June or July. So this is just a minor information for you all. Feel free to contact us. Any questions related to dentistry, we'll be more than happy to help you out. One of the issues that I'm facing is, I would request you doctors to please have some patience. I'm definitely going to answer your each and every questions, but sometimes I have to think about your answer, and there are many questions coming to me daily. So I try to read out the questions first, and when I have ample time to answer you correctly and properly, that is the time when I'm going to answer you. So whenever you send me a question or a post question in our group, definitely when time will permit me, I will read those questions, but sometimes I will not be able to answer them immediately, but please trust me, I'm definitely going to answer them as soon as possible, and generally I try to answer them by late night of the same day. Okay, so please have your patience. Don't feel that I am going to ignore your questions. Every question is equally important, so I'm going to answer them. Just please have little patience. I have to manage 3 dental clinics. I work at 2 of my dental clinics. I have to make such videos. I have to prepare for them. I have to shoot them myself. I have to edit them myself. I have daily 2 to 3 hours of online classes of different batches, and I'm also associated with many of our dental local groups. So time is of essence for me, but I'm definitely going to answer your question. Okay. So doctors, that's all from me on this topic. See you all very soon in yet another interesting dental video. Stay tuned to the channel. Thank you.